Why don't we get started?
Terrific. Thank you, Kathy. And good afternoon, everyone. And thank you for joining our first local impact session with MTA Chair Pat Foye. I'm George Walker, the Chairman and CEO of Neuberger Berman. I am also a board member of the Partnership for New York City, which represents the employees and employers of 1.5 million private sector folks here in our city. Our fearless leader, Kathy Wild, who you see in the press frequently, who speaks for the New York City business community, is going to lead today's discussion. Kathy is the person who we all as CEOs turn to for help with the city and the state and beyond. And I'm excited that you all get a chance to get to know her a bit. Last December, we released the results of a survey that many of you viewing today's webinar participated in. The purpose was really to determine what local issues matter most to New Yorkers like us who live and work here in the private sector, and then to try and mobilize our efforts to do something about it. No surprise, the top concern was the quality and reliability of public transit. New York needs a clean, modern, safe transit system to remain the greatest city in the world. Shorter term, as every one of our firms is working on extraordinarily detailed plans to keep each of us safe back in the office, it's clear to me that while these plans are important, it's really the MTA, and schools and hospitals that are going to be more determinative in how we each are able to return to work. So it's a real privilege today to welcome the chairman and CEO of the MTA, Pat Foye. Before Governor Cuomo appointed Pat to lead the MTA, he had a few careers, somewhere in the private sector. He was once a merger partner at Skadden and ran their Brussels, Budapest, and Moscow offices. And he was a leader at Aimco, which is a large public multifamily REIT. And he has served as president and CEO of the Port Authority for New York and New Jersey and as head of the state's Economic Development Agency. He has also recently fully recovered from his own bout with COVID-19. So Pat has an enormous challenge ahead of him, but I know you're going to agree after you get to spend this hour with him that the MTA is in extraordinary hands. So welcome, Pat. Thank you for taking the time to update us all on the status of the MTA and what we can expect prospectively. Pat's going to make some introductory remarks, I believe, and then Kathy is going to ask some questions, including those that you all have earlier submitted. So thank you, Pat. Thank you, Kathy.
Terrific. Kathy, how long should I speak for? How much time do you want for questions?
20 minutes, you can speak for, whatever.
That's perfect. All right, so let me start. I'm going to start by giving the group an email address of Graham Rogers. Graham works for me. His email address is grogers, R-O-G-E-R-S, @mtahq.org. If following this, I'll mention Graham's email address also at the end. If following this there are additional questions or ideas, please email them. And as I've done with the questions that came in, I've read every one of them. I'm going to do that with respect to your questions or thoughts, et cetera. I want to touch on 5 things. First is the principle we've applied during this pandemic. Second is what we've done to date in terms of protecting employee and customer health. 3, what your subway, bus, commuter rail experience is going to look like as the pandemic subsides. 4th, innovation at the MTA during the pandemic, led by our Chief Innovation Officer, Mark Dowd. And 5th, what you as customers can do to help this effort. And it is an incredibly important role in terms of protecting yourself, your fellow riders, fellow commuters, but also our employees. So let me talk a little briefly about the principles we've applied in this pandemic. One is we are transportation people. We're not public health officials. We're not medical doctors. We're not epidemiologists. We're acutely aware of that. So at every step along the way, we have relied on public health experts, the New York State Health Commissioner, the New York City CDC, World Health Organization, et cetera, as well as academics in the public health and related fields. Every action we've taken has been vetted with public health experts, 1. Two, second principle is throughout our first order priority has been protecting our customers and our employees. I think we've done that effectively and aggressively, but that's been our priority. Third is, since the first case of COVID-19 was confirmed in New York State on March 1st, the MTA had a pandemic plan before that. We have executed, but we've also changed it because COVID-19 is different than everything that's come before it. But we have aggressively approached this. We started early. We began disinfecting stations and subway cars and buses and paratransit and commuter rail stations and rolling stock the day after the first case was confirmed. And the approach we've taken has been aggressive and early, and we've ramped it up and increased it as the pandemic has gone on. Fourth is innovative steps that we've taken throughout this, and I'll talk about a little bit about an announcement we made on Tuesday and what I think the future will look like in terms of disinfecting and protecting customers and employees. And then the fifth point I want to touch on is we can't do this alone. No one can. And the participation and cooperation of our customers, especially on the mask issue, is going to be critical. Wearing masks, first of all, Governor Cuomo at his daily press conference this morning talked about the importance and the mandate to wear masks. Wearing a mask protects the wearer, it protects his or her co-commuters, and it protects our employees, and it's extraordinarily important. So those are the principles that's guided our approach throughout the pandemic. Briefly on what we've done, first, we had inventories of PPE going into this. Since March 1st, we've distributed 2.2 million masks to our employees. That includes N95s and KN95s. We've distributed nearly 5 million pairs of gloves to our employees, as well as sanitary wipes, hand sanitizer, disinfecting solutions, et cetera. We have the inventory to continue to supply our people at those levels with that type of equipment and others, for instance, plastic face masks in certain cases, depending on the job. We've got enough inventory in-house, and that we've contracted with reliable sources throughout the entire country and world to continue to support and supply our employees going forward. We, first in the nation, created a temperature brigade. At this point, we've done 150 temperature checks of our employees. One of the things, I'll just give you a preview, life after the pandemic subsides will include every employee, every workday being checked for temperature and just making a statement as to his or her fitness. That is going to be part of life going forward. We've eliminated cash on subways, buses, Metro North and Long Island Railroad in order to minimize contact between subway personnel, bus operators, and our customers. Instituted rear door boarding on buses, again, to eliminate contact between bus operators and customers for their mutual benefit. We put protections in workspaces, plexiglass. We've put plastic dividers on buses, and that work continues. We continue to ramp it up. First time in a 116-year history of the subways. We're closing, as all of you know, for the last couple of weeks between 1 a.m. and 5 a.m. That closing has been flawlessly executed by Sarah Feinberg and her team. Pat Warren, our chief safety officer, has played an important role. We did that for a couple of reasons. One is to be able to disinfect every car thoroughly every day by closing and disinfecting stations in terminal stations, the end of the line, if you will. That has helped us to ensure we can disinfect every car every day. And it also has given the City of New York Department of Homeless Services and the NYPD the ability to offer services, medical services, mental health services to the unsheltered, and to get significant numbers of the unsheltered into shelter. Important to note that nighttime service will be restored when the pandemic subsides. We've done, I think, extraordinary things in terms of disinfecting, and I'll talk a little bit in the innovation section in just a moment. On a number of these things, we've been first in the nation. The temperature brigade, for instance, where we've checked 150,000 temperatures with a very low fever rate. I think about 50 or 60 fevers were found. although in one case there were 2 or 3 employees in the same facility, and I think that temperature checking may have averted a small spike at one MTA facility. On lots of these, we've gotten calls from public transit agencies around the country and around the world as to what we've been doing. Importantly, what is your subway, bus, and commuter rail experience going to look like when the pandemic subsides? First, the approach we've taken is that everything is on the table. Public transit around the country, and I've been at the MTA about 3 years, and the senior management team is all new. We've come from various places. The chief operating officer is new. Chief innovative officer is new. Communications person is new to the MTA. We're taking an approach. Everything is on the table. We've been looking since the pandemic started at the practices and decisions that our counterpart agencies have made in Asia, which went into the pandemic first and exited first. Same thing with respect to Europe, which went in before North America. And we are actively looking at talking to transit agencies directly, talking to the trade associations, APTA in the United States, UITP on an international basis, looking at everything. As a result of the fact I ran the Port Authority in a prior life, I've talked to a number of airline CEOs. Their configuration is different. Their challenges are different than ours, but I've talked to a number of airline CEOs about how they're dealing with their challenges, and we've talked about what the challenges airlines face and how it relates to what public transit is. Point is, everything is on the table. Secondly, there is no single solution here, but what we have developed and continue to develop and will roll out is a multi-layered approach. No single thing's going to protect us. One is masks are critical, as the governor said today at the press conference. Masks are mandatory for employees, and we believe that mask compliance by our employees is 100% or as close to 100% as you can get. Anecdotally, we believe that our customers, and we're going to try to figure out a way to measure this more scientifically, our customers are wearing masks in very high percentages. This morning, and my commute's not necessarily typical, I took the 7-Eleven, I think it was, out of Port Washington to Penn, got on the 2 to 42nd Street, took the 7 across to Grand Central, and took the 4 to 59th and the 6th uptown. My sense and my colleagues' sense is that mask compliance for employees is at a very high, for customers rather, very high level. We're going to figure out a way to scientifically measure that. Masks are probably among the single most important steps that folks can take. Second is social distance. The social distance protocol is 6 feet. With a mask, even better. 6 feet will not, in the long term, work on public transit any place in the world. We have the benefit. Obviously, ridership is extraordinarily low. For yesterday, subway ridership compared to the comparable day in 2019 was down about 89%. Bus ridership down 72%. Long Island Railroad, Metro North 93 to 94, and bridges and tunnels, interestingly enough, down 45%. As in Wuhan and Beijing, our customers are starting to return by car. That's not sustainable, obviously, to cover everybody who's going to need to get into the central business district. But as in Wuhan and Beijing, there are certain customers who are going to drive their own cars, pay a toll to the Port Authority, perhaps to the MTA, and that's okay. That's okay for now. Ridership didn't drown dramatically. But social distance is something, we have the benefit of what other agencies around the world have done ahead of us. We're working with BCG and other WSP on the social distance issue. And we will be announcing as we go forward the social distance protocol. Point one. Point two, right now, as I mentioned, we're down 89% compared to the comparable day in 2019. Our service across our agencies is at the 65 to 70% level. That's the case on subways and buses. So there is a significant increase in ridership. It's not huge, but a significant increase in ridership we can accommodate with the current level of service. without violating social distance protocols. And that there are clear limits to that. Beyond that, we have the ability, because about 9,000, this is terrific news, about 9,000 of our employees have returned from home quarantine and gone back to work, which is an extraordinary statement of the transit workers, subways, buses, Long Island Railroad, Metro North, bridges and tunnels, paratransit, the extraordinary commitment to public service and dedication that they have. So that's really important news. On the social distance issue, ultimately the decision will be informed in large part by public health institutions, public health officials at the state, city, and national level. We're looking at CDC advice. As I mentioned, the first principle of the approach we've taken since the pandemic started is to look to the advice of public health officials, and that will continue, including with respect to the social distance issue. Disinfecting, as I mentioned, a day or two after the first confirmed case in the United States, we began ramping up the disinfecting of stations, beginning with doing the stations disinfecting them once a day. We're now disinfecting them more than once a day. Same is true with respect to our rolling stock on subways, buses, commuter rails, and that work has continued. I think going forward, we will see every one of our employees every workday be temperature tested, and I think that's a really important thing. We have the ability, as a result of the fact that nearly 9,000 employees have returned from home quarantine, to increase service and to increase it again. Staggered hours and work days that I know a lot of Kathy Weil's members at the partnership are thinking about, not only in the New York region, but around the country. I think staggered hours and staggered days will be an important part of this. Interestingly enough, the state and the city of New York imposed those measures in the 1920 flu pandemic, and the city and state did it 100 years ago. I think it's going to be incredibly important. Employers leading the way on that issue, and one of my themes is going to be at the MTA, the importance of staggered hours and days. We're going to have things like markers on platforms to indicate where riders want to get on and get off. We're going to do everything we can, consistent with a busy transit system, to minimize face-to-face contact. And we're very focused on in-car ventilation. We've got experts studying it. We are talking with federal officials on the issue as well. We replace our filters on subways and buses on a regular schedule. We're examining that and seeing whether we ought to do it more frequently, whether additional filters or different filters ought to be applied. The subway system not really made to open the windows on subway cars, but we're talking with public health officials about the positive effects of opening windows and taking other steps, including perhaps leaving some of the doors on commuter rails open. We haven't made decisions on that, and again, the decision will be based on advice of public health officials. And let me just mention, the CDC in the last day or so has come out with advice which is important, and they have emphasized the likelihood of spread of the virus based on human-to-human contact. And while you can, in certain cases, get it from touching an obstacle in your home, in your workplace, on transit, the greater preponderance of the case, it is now believed by scientists and CDC, is human-to-human contact. So we're very focused on that in the subway and mass transit commuter rail environment. Lastly, we're taking the time. Obviously, ridership is at an extraordinarily low level, and we're taking advantage of the time because we inconvenience fewer customers to do as much work on state of good repair and maintenance as possible, finishing capital projects that have been in the works. Let's talk briefly about innovation. I'm extraordinarily proud of the announcement that the MTA made on Tuesday with Dr. David Brenner at Columbia, the Columbia University Irving Medical Center. It was the first ever confirmation Dr. Brenner was able to show that ultraviolet light kills the COVID-19 virus. The MTA was reached out to Dr. Brenner, hired him as an advisor and consultant. He's one of the world's leading experts on ultraviolet light. And that announcement on Tuesday is extraordinarily important. We are just about to start a pilot with compact ultraviolet devices, which would be deployed when no human beings, either customers or staff, were on a subway car or on a bus. It's clear that ultraviolet is a successful technology that's proven, been around for decades and decades, used frequently in hospital emergency room, operating room scenarios. And now we've established, and we're proud to be part of that, Dr. Brenner's confirmation that the ultraviolet will kill the COVID-19. We're also looking at far ultraviolet light, which is on one end of the ultraviolet spectrum, which could in certain connections, and again, we haven't made any decisions on it, on this technology, and it will be made in consultation, each of these things, with public health officials, obviously the union leaders who represent our employees. Actively looking at and piloting antimicrobials, which kill viruses. Work is underway to confirm that it kills the COVID-19 virus. That's important work. And then beyond that, the proponents of antimicrobials suggest that the virus-killing efficacy may last for days, weeks, and perhaps months. We've been piloting antimicrobials since middle of March. We've deployed it twice throughout the entire system. It's an EPA-registered product that's safe for the public and safe for our employees. And we believe that we could have significant breakthroughs in the short term on some or all of these technologies. We are seriously looking at a reservation system. This has gotten a lot of interest. It's not as crazy an idea as it seems. It's the type of idea that may first be deployed on commuter rail. We've reached out to some of the leading technology companies that have workable reservation systems, both outside transit and inside public transit, and we're looking at that. We've been working both before and during the pandemic with the Transit Tech Partnership, which is an operation, an affiliate of the Partnership for New York City, which has provided, in my mind, already $10 million of value to the MTA. The Partnership for New York City setting up that Transit Tech Lab about a year ago. No one foresaw the pandemic, but the MTA has gotten substantial value out of the companies that the Transit Tech Lab has introduced us to, and they have performed important work during the pandemic. We're looking at metering the number of passengers on cars. There's a technology that helps us using anonymized cell phone data, tell us how many passengers are on a subway car, on the next car, on a platform, and a mezzanine, and that will help metering. We're looking at apps and are talking to some of the leading real estate companies in the city and around the nation about what they're going to do in terms of their employees, perhaps signing onto an app before they come to work, do a temperature check, make a statement about fitness and health. We're looking, as I mentioned before, seriously at airflows and what that means and what changes, especially given the new CDC advice in the last couple of days. And before turning it over to Kathy and talking about your questions, all of which I read and I thank you for, the question is what can you do to help? First, ideas and thoughts are welcome. And again, G. Rogers at MTAHQ, welcome your input. But masks are extraordinarily important. The governor this morning reaffirmed that. He also made it a directive and a mandate, and wearing masks protects yourself, it protects your co-commuters, and it protects our employees. Last thing is self-help, right? If you are on a car and you see someone who doesn't have a mask on, go to the next car, get off, move around the car. We all tend to be creatures of habit in our commute, come down the same staircase, get on this, the fourth subway car. If that area is crowded, move up or down the platform. Self-help is extraordinarily important. Lastly, I want to thank two groups and then turn it over to Kathy. One is our employees throughout this pandemic have performed heroically, brilliantly, and effectively in the most challenging circumstance ever. We've suffered a tragic loss of life among transit workers in New York City and New York State are the epicenter of the pandemic, and no part of New York or the state, New York City or the state has been untouched. But we thank our workers across the board for the extraordinary work they've done. And I also want to thank our customers who have cooperated with this in terms of wearing masks, in terms of being patient on the 1 a.m. to 5 a.m. Closure, which has obviously been new for New Yorkers. But there is a robust bus and for-hire vehicle program that's been put in place. And I think the work that we did, reaching out to the Partnership for New York City, reaching out to the 5 borough chambers of commerce, labor unions, employers, grocers, drugstores, et cetera, I think has served us well. I thank you for that. And Kathy, I turn it over to you.
Very much, Pat. I'm muted. I tried to get unmuted. Okay, thank you very much, Pat. I am unmuted and appreciate, obviously everybody sees what how fortunate we are to have you in a leadership position and recovered from your COVID-19 bout and taking on this task. People are getting ready to go back to the office, many of us. It sounds like we're getting close. New York City seems to be is the last region in the state to be allowed to start resuming a phase 1 activity, which means that certain industries will go back, but that should move over the summer toward coming back to work. And I wonder, some of the stuff that you're talking about in terms of safety, protection, et cetera, it sounds prospective. Are you ready in the middle of June for people to come back in any kind of numbers? What do you see as kind of the pace of the return?
So Kathy, let me make a brief public service announcement, which is everybody watching today ought to think about donating blood, or if they've had COVID-19, think about a plasma donation. I fortunately, it's not about me, but I fortunately had a very mild case. I donated plasma last week at Stony Brook University Hospital. Mount Sinai is very active in clinical trials. And whether it's plasma or blood donations, really important to think about that. End of public service announcement.
Thank you.
Here's the answer. We have the ability to bring more service. Obviously, the latest data I reported, ridership's down 89% on the subways. Not quite as dramatically, but 72% is a huge drop on subways. Commuter rails have been extraordinarily low. We have the ability to bring ridership back. We will be doing things like, for instance, barring people from by markers or devices that not every seat on a bus ought to be filled, not every seat on a subway ought to be filled. We'll be complying with the directives of public health officials from a social distance point of view, and we'll be taking that advice, and we're talking to public health officials and all over the country, all over the world. The short answer to your question is, do we have the ability at some point in June, say, when the governor begins to lift the restrictions on New York City to accommodate increases in ridership? Yes. We are going to have to be focused, as we will throughout this pandemic, on crowding. And for instance, Sarah Feinberg and her team, when we encountered some crowding at a couple of stations on the 2, 4, and 5 in the Bronx, we added additional subway service. We were able to do that even at the height of the pandemic, and additional bus service. We're going to be monitoring it on a real time. We are also going to be, we're putting together a system to communicate to our customers in terms of crowding on particular lines, on particular stations. We're not in a position to deploy this yet, but one of the transit tech companies and its affiliates is helping us in terms of how many people on a subway car, on a mezzanine, on a platform. The short answer to the question is is yes. The most important thing that customers can do coming back is wear masks. That is really fundamental.
Well, to that point, I listened carefully, and you never said that you're going to require customers to have facial coverings when they come into the train or the subway.
Oh, no, we're going to require it. The governor made clear today at his press conference that it's a mandate. It's a requirement on subways, buses, commuter rails, et cetera, period. Look, in most cases.
And in the stations. And
in the stations, of course. It's not going to be a matter in most cases, all but the smallest percentage of cases for police enforcement. I think that good old-fashioned, New York friendliness, but also candor will. I think customers will, make comments.
Are you going to have masks available for customers if they get to the station and don't have one?
One of the things we're exploring, Kathy, is PPE vending machines. We haven't deployed those, but I think that's probably an attractive business opportunity for somebody. We don't have the capacity to bring millions of masks a day. And frankly, because it can be a surgical mask, it can be a scarf, it can be a bandana. Customers, this is an area where customers need to do self-help. They need to bring their own masks, as I described on, my commute this morning, which, I guess is typical. I was on 3 or 4 subway lines and one line on the Long Island Railroad. Every employee I saw had a mask, and the percentage of customers was well over 90%. Anecdotal, not empirical, but wearing a mask is mandatory. It's not an option, and it is the smart and humane thing to do.
And so if somebody shows up to the station without a mask and opens the gate and sneaks in, what's the enforcement?
Well, look, I'm not going to. I'm not going to mislead. Yeah, I'm not going to mislead. Yes, I'm not going to mislead anybody. We're not going to have a police officer or a transit worker on every car or every bus in the system, right? We've got over 6,000 subway cars and 5,000 buses. I do think that, and this is the experience of our colleagues as well on the customer side, my colleagues as well on the customer side, there's been a very, very high degree of compliance. It needs to be as close to universal, close to 100% as possible. And if someone gets on your subway car without a mask, stay away from him or her. Go to another car. But
could you put a number out, or could you put a number out, a 311 type number that people could dial? Or
so we're doing that. One of the things I suggested to my colleagues, and we're looking at it, is doing mask compliance checks so that we would know and we could publish it to customers. We're working through the issues attendant to that. I think texting New York City Transit or MTA is something that folks can do on a real-time basis. Those are monitored 24 hours, 7 days a week, and we're going to be as flexible and nimble as possible in responding to those things.
It seems like there ought to be some way to report when you see a situation rather than creating possible altercations.
I completely agree. And I think the easiest thing to do is to text or send a tweet to New York City Transit or the MTA.
And there were concerns raised in the questions that I'm sure you saw about not just compliance with the mask and other requirements, social distancing requirements, but also just crime on the subway. Is there going to be, as with the economy and the shape it's in, the number of people who are going to be unemployed this summer and into the next year, it's going to create some tensions more serious than already existed. Is there a capacity for expanded police and security presence?
So that's an excellent question. I'd say a couple of things. As riders come back to the system, lots of riders create social controls on conduct in any urban setting, right? And the unemployment issue that you described is not, and the consequences of that is not peculiar to public transit, obviously. One of the things we are doing, and we were prescient in this, and the governor's support of this was prescient. We're in the process of hiring an additional 500 MTA police officers who will be working primarily on subways and buses. The NYPD has primary responsibility for policing, and they've been activist and extraordinarily, NYPD has been extraordinarily helpful to us on the 1 a.m. to 5 a.m. Closing and dealing with the unsheltered. I think the hiring of additional MTA police will be really helpful and part of the solution. About 160 of those officers are already on board, and more are coming.
There was a nuance when you spoke earlier about. I wasn't sure if you said that you were going to reopen the subways from 1 to 5 a.m. I have, in looking at the questions, it seemed like there was a real interest on people of the fact that the subways were being thoroughly cleaned during that period, and also importantly that we were dealing directly with the problem of homelessness, which was a huge problem before the COVID-19 and is something that's top of mind with a lot of people now. If you eliminate if you open the trains again on the 1 to 5 a.m. period, doesn't that create the problem all over again?
No, I don't think it does, Kathy. I think that we have come up with a way to clean. We are coming up with a way to clean every car every night without the closure. We're not in that position now. Some of the innovations that I talked about, the antimicrobials, the ultraviolet, other things, and frankly, the machines to help in hand-to-hand cleaning to increase productivity. That'd be point one. Point two is with respect to the homeless, real progress has been made. I think it's too early to celebrate because there's clearly far too many unsheltered people in the subways. No one's doing the unsheltered, the homeless, a favor by allowing them to sleep on city streets or on subways or other environments and getting them the services they need. Obviously, some significant portion of the homeless unsheltered are suffering from emotional issues and deserve help. And the city providing shelter, whether it's a safe haven or a group setting or a hotel room, I think is extraordinarily important in reducing the number of homeless. We can accommodate and accomplish both those goals. I'm confident of.
But is this because I know there's New York is the only 24/7 open transit system. There's we're the city that never sleeps, et cetera. But at the same time, for some period of time, you're not considering, as we reopen over the next couple of years, you're not considering keeping them closed at night so that you can continue that discipline that you've established?
No, as the governor said, and we said in our press release when we announced the closing from 1 to 5 a.m., it was during the pendency of the pandemic. We're all obviously rooting for that to be sooner rather than later. And I think we all have to recognize that the lifting of restrictions around the state and other regions, and ultimately Long Island, Mid-Hudson, and the city is the first of a multi-phase approach in terms of lifting the provisions, limitations, or restrictions rather of New York on pause. So the 1 a.m. to 5 a.m. Closure is likely to be in place for some significant time, but the plan is ultimately when the pandemic is over to restore that service.
Okay, so there's several other questions here in terms of on the commuter rails. Let's start with more of a focus on that in terms of when you're going to be resuming regular service and at what pace. Will you be adding more trains? What are you going to be doing on the in terms of the timing of service and returning to normal service schedules?
So subways, buses, Metro North Long Island Railroad, we have capacity that's available whether it's Sarah Feinberg or Phil Eng or Craig Cipriano or Kathy Rinaldi could bring in very short order. One of the reasons we have that capacity and we're holding it back is because the 9,000 workers have been on quarantine and have returned healthy to the workforce. We are considering short-term increases in frequency on each of those. Agencies haven't made any decisions, but we have the capacity to do it. Obviously, when we're down, 89% on subways or 93% on Metro North and Long Island Railroad, for instance, we're running half-hour service during the morning rush. For instance, the train I took this morning, there's lots of social distance on Long Island Railroad and Metro North, as well as subways and buses. We have the ability to accommodate additional ridership. We're going to have to manage it and look at it closely. We also have the ability happily to increase service. We might do that in a multi-step process, but we're looking at the data and models very carefully. We're in close coordination with the governor's office. Obviously, Governor Cuomo declared the state of emergency, but we're also talking with City Hall on these issues, as well as the county executives, Nassau, Suffolk, Westchester.
And are you going to be, you mentioned that you were contemplating the possibility of reservations and technology that would allow commuters to check in on the conditions, how crowded a train was. Employers are trying to provide more flexibility to people in terms of the times they come in and staggered hours and days. Is that something that they're going to be able to know what's going on in a real-time basis on their chosen commute route?
The answer is yes. We've got apps for subways, buses, Metro North, and Long Island Railroad. The clock down, the countdown clock in your pocket, which is basically the app, on your smartphone, works, and will tell you that at 34th Street, Penn Station, there is a 2 train going southbound, and it'll arrive in 3 minutes, and the next one will be 4 minutes after that. Whatever the facts are, we're going to continue that. We're going to take some of those apps, which I think have served our customers well, to the next level. And one of the things I'm proud that Sarah Feinberg and Pat Warren and their team, Sally Librera and Craig Cipriano, did during the beginning, first couple of weeks of the 1 a.m. to 5 a.m. closure, was being able to add additional bus service, for instance, for doctors, nurses, healthcare professionals, and also to be able to supplement that on the fly. We did that when we had the crowding issue that I described in the Bronx on the 245, and we're going to continue to do that. Our command centers are open 24/7. We want to do everything we can to make the commute as seamless as possible. And that's not always, a guarantee that we're going to be able to deliver on, because, sometimes things happen in mass transit, but we're very focused on making it as seamless as possible and being able to make adjustments on the fly, as well as the ability to bring up service.
We should probably mention that Sarah Feinberg is the president of the New York City Transit Agency, Subway and Bus Agency. And for those who don't know, you've referenced her a couple of times, and you just mentioned also Sally Librera, who is responsible for the subway system. So I'm glad you got some good women in there.
Absolutely. Well, and also Kathy Rinaldi, the outstanding president of Metro North, and Phil Lang is a star at the Long Island Railroad. Thank you for the props, Kathy.
Okay. Pat, would you switching over a minute? There were some questions. People have real fiscal concerns for the MTA on your budget situation as to how are you going to be able to achieve all these goals, introduce the new technology, keep the modernization capital program going, hopefully, because that's a very important piece of what's going on for better reliability. And these were problems we had before the COVID-19 crisis. Unfortunately, the ambitious $51 billion budget is at risk. And I think people are really concerned, and part of restoring their confidence in the system is going to know that there's a way to pay for it.
Yeah, Kathy, so among the people concerned about the MTA's financial situation is me. Let's talk about operations first, and then capital. In the short term, the CARES Act, which was the first round of funding for public transit, provided about $3.9 billion to the MTA. That is to help with the operating loss for 2020. I want to thank President Trump for signing it and for expediting the payment. We got the first installment last week. I want to thank Senator Schumer for his leadership throughout. Nita Lowy, the chair of, has done extraordinary work, and that CARES funding was supported by the entire New York congressional delegation on a bipartisan basis. We've also asked for a second, and I'll sketch out the numbers briefly in just a second. We've asked for a second round of funding, an additional $3.9 billion, which Speaker Pelosi included in the bill that she released about a week ago. That was extraordinarily, I guess, on the 12th of May. That was extraordinarily important. The Speaker, Senator Schumer's, although it was a House bill, obviously, Chair Lowy, Congressman Jeffries, Congressman Espaillat, and the entire New York delegation, including, for instance, Peter King, who has been, supportive throughout, Congressman Zeldin, with respect to the first round of CARES funding as well, extraordinarily helpful. Those amounts are intended to get us through 2020. We hired McKinsey to do an analysis of three things. One is the decline in revenues that comes from tolls and fares. About 50% of the MTA revenues comes from tolls and fares. I gave you the stats before. I gave the group the stats before. 89% down on subways, 93, 94 on Sundays, 97 Metro North and Long Island. That's got a substantial impact. And the other half of our revenue comes from a package of dedicated taxes and subsidies, local, state, and regional. And those two in the pandemic economy that we're in have fallen off a cliff. If we get the second round, the HEROES funding, as the Speaker Pelosi bill is characterized, that will take us through 2020. We will need additional amounts for 2021. The state legislature, under the governor suggested in the budget a number of steps to increase the MTA's flexibility at the state level. For instance, deficit financing, which was not something that we are eager to do. It's not something we had the ability to do previously, and the state legislature gave us that option. It's not something that we've taken advantage of so far. So we've got significant financial challenges as a result of the pandemic. As you noted, we had significant financial challenges going in to 2020. Just based on the cost structure of the MTA, which we're in the process of dealing with pre-pandemic through a transformation process. On the capital side, the MTA board unanimously approved a $51.5 billion capital plan. It was approved by a state agency that has to approve it. Also, unanimously went into effect without a negative vote. Largest by far capital plan ever, huge amounts, largest amounts ever for ADA elevators and escalators in the subway system, resignaling 6 subway lines with the technology called new and advanced communication-based train control, and investments in stations and power, as well as significant investments in the Long Island Railroad, Metro North, and the bus fleet, including the largest order of electric buses, I believe, in the history of the country. Significant part of that, about 30% of the $51.5 billion came from central business district tolling, which was approved by the state legislature and signed into law by the governor in April of 2019. We began a process with US DOT, which has to approve central business district tolling. For legal reasons, I understand, but for business and environmental reasons, baffle me. I don't understand it as a policy reason, but the law is the law. The federal government has not...
You're talking about congestion pricing now, just to make sure that everybody...
Forgive me, central business district tolling is the official and more polite name for congestion pricing. The federal government, thanks, Kathy. The federal government has not acted on it, US DOT. That's a disappointment. As I said, we met for the first time more than a year ago, a week or 10 days after congestion pricing was passed by the state legislature. We continue to work and advocate and cajole and push. And as I said, that's 30% of the capital plan. Obviously, the deterioration in the New York economy as a result of the pandemic is going to have an effect on other revenue sources leading to the capital plan. We are continuing capital work that was in process, and Jano Lieber and his team have done an extraordinary job on that. You may have read, I know you did, Kathy, some of our viewers today may have read about the success in bringing in the L train tunnel on time in a very challenging environment. That was extraordinary. Progress continues on East Side Access, which Jano has assumed control of and put on a 2022 schedule. Same thing with respect to third track, a really important project for Long Island Railroad. So there's lots of reasons to be optimistic there. The decline in ridership gives us an opportunity to do more work without influencing customers. But to execute on the $51.5 billion capital plan is going to take both funding and economic recovery. We're committed to maintaining and investing as much of that as we can responsibly.
I think people ought to know that that's the replacing the signaling system, which is a big chunk of that, which is what will allow the trains to move more quickly and more reliably, which is an important part of the issues you face. So it's a big challenge as to how that money is going to be replaced, and obviously something that everybody has to be concerned about. And for those who are in a position to be helpful in Washington, letting your congressman know how important this the federal support for the MTA is, this second $3.9 billion, is really critical to when we ask what's going to happen with the transit system. Will it be safe? Will it be clean? Will it be reliable? A lot of that, the answer to that question at this point depends on federal support to make up for this, and not a bailout. This is to make up for the huge revenue losses and extra expenses that the system has had during this period solely because of the COVID-19 virus. So I think that's important. Pat,
Kathy, let me just make one point about why it matters to the people watching, and let me just give you 2 data points. So the 7 line got the new resignaling technology middle of last year. On-time performance on the 7 went from about 60, a horrible number, somewhat affected by the construction project that Kathy and I have been discussing, and it is in the 90s, above 90, pre-pandemic. And we were able to add 2, 3, 4 additional trains in the morning rush and in the evening rush. The 7 line is the line I grew up taking as a kid, 74th Street and Roosevelt Avenue, and is one of the most crowded lines in the subway. And being able to add pre-pandemic those additional trains in the morning and evening rush, incredibly important to customers. So this is real impact on millions of customers' lives.
you know, another question, some from Staten Island, some the Rockaways, communities that are dependent on bus service, both regular bus service and express bus service. There was a re-examination, replanning of the bus routes that was underway. What's happening there?
Well, the Staten Island bus redesign was completed. It has improved bus speeds on Staten Island, including express buses. This is pre-pandemic. I think that we did that in close consultation with Borough President Otto and the Staten Island legislative delegations. And, you know, look, it's New York. Not everybody was happy with every piece of it, but the Staten Island bus redesign, first one to be done. I think done with the cooperation and support of the elected officials who, and I think the bulk of our customers have pre-pandemic, obviously the pandemic changes everything, including bus schedules, has really improved the life of Staten Island bus commuters.
Another question that had been asked was, would you recommend that people look at one form of transportation over the other, meaning express bus, subway, trains, commuter rail?
From a public health point of view?
They didn't say.
Well, look, it's going to depend on what's convenient, what service best serves you. We're going to give our customers as much data. We're doing this now, and we're going to add additional data. We're going to give our customers as much data as we can in terms of when is the 2 train coming into Penn Station, when is the next one after it, and we're also going to be providing. We want to be transparent because we think that helps assure our customers and our employees, and we'll be providing will be providing metrics on those issues as well. The more data we can share, I think the better off everybody is. And I think it's fair to say that the MTA sharing of transit data over the last in accessible forms on iPhones and apps and websites has increased substantially, and we've got more work to do coming out of the pandemic.
And another question that I didn't hear you address, questions on the physical equipment side, are the contactless cards or contactless admission fare and the buying a Metro card or a card in the machines, the vending machines, and how those.
Yeah, so that's Omni. Omni validators are being installed. Our original goal was to get them all done by October. We took a month hiatus during a pandemic, but we have come up with a way for the validators to be installed on a way that is safe for the workers doing the work. Thanks to Al Petray and his team, installations have begun, and the subway system and bus system will have validators universally by the end of the year. And Omni may be part of the solution in terms of it wasn't set up, it wasn't created for this purpose, but it may have other uses coming out of the pandemic. We're talking with Cubic, which is the company that we contracted with, which has really performed well prior to the pandemic and during it, and we're exploring also other technology providers. But Omni will be completed by the end of the year, and I'm pleased by that.
I believe that would be Cubic and our own New York MasterCard is part.
Amen. That's exactly right.
Thank you. So Pat, I think the issue that everybody has obviously is one of confidence, credibility. You inspire confidence and credibility, but I think that one of the things people will be looking for is how are you going to communicate with the customers clearly and keep them informed, and how are you going to make sure that they see the kind of improvements you're talking about when they take their first trip or go to the station for the first time?
So Kathy, that's an excellent question. I would make this point. We are acutely aware here, as is Governor Cuomo and his team, that the MTA is fundamental to the recovery of New York City and the New York City regional economy, which is nearly 10% of the national economy. The way we're going to do that is by decisions of millions of customers. We don't have millions of customers today, but we did 2 months ago. And it's going to be dependent on the decisions of millions of customers, tens of thousands of our employees, and hundreds of thousands of employers throughout the region. We're going to do that by communicating transparently and candidly. I think both Sarah Feinberg and others of our colleagues and I have been active in terms of press conferences, radio shows, TV shows, webinars like this one, and I thank the partnership and you and George for setting this up. And I'm happy to come back at some point if that's useful. I do welcome the input of your viewers today, and I think we are going to over communicate. We're going to be transparent. We were happy to report the great news on the ultraviolet with respect to COVID-19 on Tuesday. I hope to be communicating future successes, but if we run into a difficulty, we're going to be candid and we'll communicate that as well. And I think our customers both deserve and will demand that.
Well, thank you, Pat. Thanks for all you have done throughout this effort, for the work of your team, the transit workers. They really have carried on and kept things going as essential workers when a lot of us who are office workers have been at home, not happily necessarily, but we've been at home. And so we really appreciate that you're out there doing this great work. Thank you, George Walker. And thanks to everybody who joined us. If you want to hear more and keep in touch with what's going on at the MTA and the other essential service providers to us as we reopen, hopefully, the economy of the city and the region in the next few weeks, please stay tuned to our local impact site that's up and running, and we will keep the information flowing to you. So thank you all very much. Thanks, Pat, and your team for all your efforts.
Thank you, Kathy.